Welcome to another episode of Sisterhood of the Scalpel. I'm Dr. Maryam Zamani.
And I'm Dr. Julie Khanna.
And today we wanted to talk about something that's very near and dear to our hearts here at ICLS, and that's doing procedures awake with you very comfortable. That's something that's quite unique that we do offer, and we have lots of little tips and tricks up our sleeve that make this experience just really much more comfortable for you, something that definitely patients are interested in and keep asking more and more of us.
You know, we want to always make you comfortable and we want everyone to feel good. So people are a little nervous about general anesthetic, but they're also nervous about local freezing because they're like, what if I feel things? So like Dr. Z said, we have some tricks up our sleeve. Our two big tricks is the pharmacy makes a special medication for us. We designed it, we get it made just for our patients to make them more comfortable. And it's awesome, isn't it? Because we have this little lozenge called MKO, and people aren't like drugged and sleepy. They're just so chill and relaxed.
And there's, always patients are asking, it's like, am I supposed to feel something in particular? And the answer is no, you're just become more calm about the whole situation. And the entire process, again, becomes much more comfortable for you. So that's one of the first steps that we take is before you're even in the room with us having the procedure, we make sure you're starting to feel much more nice and comfortable about it.
Yeah.
The second step, a lot of times as well, is for certain areas that we operate on, we do put just look anesthetic on top of the skin to take away some of that sting from the local freezing going in. And that's a really useful adjunct as well. We'll talk about with surgeries, we tend to use that in more so than others. So that also is something that we do preemptively to help you feel more comfortable. So you've already had that. Now we're walking together into our procedure room. You'll notice our nurses all have, you can't see their faces because they're wearing masks, but you can see them smiling and they're ready to greet you with your name. We have music playing in the background. We put warm blankets on you. And so it becomes kind of as cozy an environment as possible. And that's all done intentionally to make sure that you're starting to have a lovely experience with us.
And you know what? You can pick the music. Some procedures you can bring your phone in if you want and be playing on your phone. It's a very different local freezing experience than people think about. And one of our things that we have, and I don't know, you guys have probably heard about it. A lot of women out there may have used it in labor. Is laughing gas, and we always think about it for the dentist, but we use it all the time, and patients love it because A, it's quick acting. B, you're happy. It's called laughing gas. And C, it wears off in 10 minutes after you do it. So there's certain procedures, if we don't give you any oral medication, any pills or any lozenges, you can use laughing gas and 15 minutes later, you can drive home. So that's huge. So we offer that to all of our patients if they're eligible. It's a great adjunct to what we do.
Absolutely. And it's not one of those things, if you've been on those viral videos where you see people getting filmed and just being silly and things like that, that's not what this is. You are having a grand old time. No one is going to be, you're not going to be making a fool of yourself in any way. So it's not quite the same thing. You're not chuckling away. Although if you do, we love it. We will chuckle alongside with you. The other thing that we always do, and this is something that's called Pronox, that laughing gas, in case you hear about it, that's what a lot of times it's referred to. The other thing we do is also we pay attention about the medications that we use in your local freezing. It's important because we address both something that acts quickly, so you get that freezing effect as soon as possible. We also mix it with a medication that acts longer, meaning that even after the procedure is over, for a couple of hours, you're still feeling that nice numbing effect, so that it's just the overall experience, again, is nice and it's comfortable by the time you're able to be home. And if you need to take a Tylenol or an Advil, you're able to do so at that point in time. We also mix in a little bit of a special ingredient that actually takes the sting out of the local freezing. That's a really important thing. If you've ever been someone who's had local freezing, you feel that initial jarring of, ouch, that hurts. It's because there's a little bit of difference in terms of the pH, and we do something that helps with that. So that's important to know.
So when we go head to toe, let's hit some things that we routinely do under local. So on the face, we do a lot. We do lumps and bumps, moles, cysts, all the time. We do upper eyelids. Upper eyelids is 20 minutes, 30 minutes under local. And you know what we love is we love chatting with our patients when we're doing it. People think that they have to be like super still and not moving. And that's not the case. Like it's really relaxed. We learn so much from our
Mhm.
patients and we educate our patients about where to buy their mother of the bride dresses. I mean, we've had all kinds of fun conversations. Earlobe repairs, split
Mhm.
earlobes or keloid earlobes, do those all the time under local. And then you might be surprised some of the bigger things that we routinely do under local. Liposuction of the neck with radio frequency to get that skin tightening and neck lifts. We do
Mhm.
those under local routinely. All right, move down, Dr. Z. What next?
So, so we've already done the face and the neck. So now we're moving on to the chest area. There are little procedures on the breast that we also do under local freezing. So one of my favorite is repairing inverted nipples. And that's something that's done very easily and comfortably under local freezing, or reducing the size of a nipple or how much it projects if that's sometimes a concern, or very rarely, even if the areola, the colored portion of the skin around the nipple is too large, sometimes that is something we'll reduce under local freezing. And as always, as we're moving down along the body, anywhere we've talked about liposuction of the neck area, it's a small area. If we similarly have one area or a small area we're doing on the body for liposuction with or without skin tightening, that's also a really great portion to do with you awake and comfortably anesthetized with just local freezing. And everyone is really truly surprised when we do that. And then, they come back wanting more. They're like, well, we did that under local freezing. Can we also do this under local freezing? So it's always a really good option. The last bit that we always like to point out, because this is a surgery that for some reason a lot of women are put to sleep for and we don't quite understand it, is labiaplasty. We don't necessarily need that at all. Of course, if someone has a lot of anxiety and requests to be put to sleep, we always talk about the pros and cons of doing that, and we do have it as an option because we always work with board certified anesthesiologists. But most often, this is not something that you need to be put to sleep for. Again, using that triple combination of really effective modalities that we have. So putting on the local freezing on top before anything goes on you, good half an hour, 45 minutes before, it gives a really good numbing effect. So you don't really feel the needle going in as we're freezing the area. You have the choice of getting our little lozenge that we talked about that makes you really nice and comfortable. And as always, the laughing gas is available as well. I had a patient that was having this procedure done, and she was texting her sister at the time. She could not believe how comfortable it was, and her sister was floored that she was doing this from the operating room. Of course, safety is always number one. So if we need to ask you to put something away for your own safety, we'll ask you to do that. But otherwise, if you're comfortable, hey, listen to your music, listen to your Spotify, watch your YouTube videos, scroll on Instagram, whatever you want to do, that's fine by us.
And it's really important because the important thing is here is at ICLS, we have the full spectrum, local to full general anesthetic to an overnight stay. We like taking care of our friends. If you need to stay overnight with us, you stay overnight with us. So you don't have to fit into one slot. We talk with you, talk about pros and cons, and we can decide, is it local, is it general, is it overnight, or IV sedation with anesthesia. We have it all.
So if you like the content that you heard today, please don't forget to subscribe, follow us on Instagram, on all our channels, and please shoot us messages. We're always listening, wanting to know what you guys want to know about from us. So please don't hesitate to reach out. And as always, our doors are open. We would love to see you in consultation and talk about whatever it is that we can help you with.
I'm Dr. Julie Khanna.
And I'm Dr. Maryam Zamani. Thank you for watching today.